Hello, warriors. Hello, healers. Happy Monday. It's a Monday the time I'm recording this. And I want you guys to watch this video until the end because I have new information. We are doing something new with the promotion that we have running right now, which is the CBD. Okay, so as you guys know, I'm always going to research. I go to tons of seminar. My job is to really keep up with the latest when it comes to healing your body. Healing your body naturally, the conventional way, is not the same as just popping a pill. And that also includes the supplements and the vitamins. Because yes, I do give you supplements, but if you guys really study the supplements that I gave you, they are herbal based, right? Even if you can find the supplements online, but the way I use the supplements, I put them in my protocols completely different than most practitioners. And the fact that you have access to me, to my expertise, to my team, that makes us different. But when it comes to IV vitamin therapy, that is the therapy where you can get results quicker and faster. And many of you guys that are watching the video can attest to that. IV vitamin therapy cannot replace any pills, okay? It is a completely different thing when you infuse the nutrients straight to your veins, straight to your cells versus taking a pill. The absorption rate is different, and as we know, many of us have severe abdominal issues or gut issues or malabsorptions, and the pill sits there, we are bloated, we are gassy, even if we have secondary symptoms are the symptoms that is not gut related, but you feel it externally or outside of your gut. An example of secondary symptoms are rash, or psoriasis, or eczema. All of the things are coming from your gut. Another example of secondary is fatigue, right? Like it's not a gut related situation, but yet if I were to give you something for fatigue, like a pill, like for energy, drinking coffee, you drinking it is going to your gut, and that's how you get the energy. With secondary symptoms that many of you guys are experiencing, you don't think you need IV vitamin therapy, but the goal is to really feed your cells exactly what it needs to feel your very best. So IV vitamin therapy, whether you live here in the state of New Jersey, you come to my clinic because we use IV vitamin therapy here for healing purposes. You need to make sure part of your healing journey, part of your protocols is to include a few IV therapy treatments. Now, you do have to do your due diligence, as I tell all my patients, ask questions, go on the website, making sure that the people that you're getting IV vitamin therapy from, they are sons. They use it for healing. It's not like a must-have, right? Because when you go to lounges and drips and spas, those are must-have IVs. You feel good, but it really, really doesn't really address the problem. But when you use IV vitamin therapy for healing purposes, the dosage matters, the source matter, the frequency matters, and the amount also matters, right? Because if I have energy and I'm thinking I can only do one energizer IV and then I'm sorry, if I need energy or have fatigue and I'm thinking all I need to do is one IV vitamin therapy, I'm gonna have energy forever, it's not gonna work. You need the energizer IV. You also need the MIC B12 injection, and you might also need some other IVs like vitamin C to address some of the root causes of why you have lack of energy, like inflammation, like poor immune system, infection. So high dose vitamin C or ozone therapy, you also can be very beneficial to help you regain your energy to allow your cells to create mitochondria. Okay? So I'm saying all this leading up to our CBD drip. CBD is good for everyone. CBD is good for everyone. You don't have to have pain. You do not have to have anxiety. You do not have to have sleep disorder. But if you are one of the people that are looking to relax your nervous system, to feed your cells some, how would I say, some parasympathetic nutrients. That's what I call CBD because it puts you in a state of relaxation and calmness. Okay, depending on the dosage, we all can benefit from CBD. Now, if you one of those people like myself who doesn't have major issues, but I still want to experience the benefits of CBD, I will do my CBD drip towards the end of the day. So when I go home, for all of us that are irritable, PMSing, okay? Like on the nervous system overdrive. I don't have to yell at my kids. I can just smile at them and just really take care of them in a calm way. That's why I believe, that's why I believe CBD is good for all the humans out there. With this promotion, we are giving it in a packaging. What does that mean, Dr. Genty? All my other promotions, you can go purchase one, purchase two. We recommend four, we recommend six, but you can start with one. Not for CBD. You must purchase a package of four. It is the only IV infusion therapy that I have that you have to package it. Okay? Let me give you an example and you're going to see why you need to start with four. If I come to you and I have back pain, and I say, you know what, that CBD thing sounds good, let me do one. Do you think one drip is going to completely eliminate your back pain? It ain't going to happen. Excuse my French. Okay? Having pain is different than I'm going to do an IV for energy. Having pain is different than I'm going to do one drip for vitamin C. So if you really want to get out of pain, or you want to decrease your inflammation, or you want to really address your anxiety and you want to sleep better at night and you want to get rid of your headaches, migraine, or you want to feel calm for a long period of time, you must start with four. Some people are going to need six, some people are going to need more than that. But we start with four. So as I am studying this and I'm evaluating this, I'm like, this is not one of the things that people can do one. And I know we all want to try it, right? Like, I want to try one and see how it goes. You are going to feel an improvement with one because the patients that have received the CBD IVs, and I had 5 people on a beta group, they felt the difference with one. However, that one did not completely address or halfly, like 50%, 50% address the problem, like, 50% of the time. We cannot just take one multivitamin and be like, I have all the vitamins in the world now. I don't need any more, right? We cannot just take one pill for high blood pressure, for diabetes, for your autoimmune condition, for whatever, fill in the blank and be like, oh, one pill is good. We don't do it like that. That's why we have to have four. Okay? So I want you guys to come with the mindset of purchasing four, and you purchasing four, and you allowing those cannabinoids, that CBD, to actually produce long-term results for you. You understand? And as the clinical expert, as the practitioner who has been doing this for a long time, literally paying money, investing in myself so I can bring you guys in my business, so I can bring you guys the latest, the greatest, we're not doing one. You must purchase four. And I know when you guys listen to this, like, well, I don't know if it's gonna work, Dr. Genty. I've never done it before. This is new. I don't really need it. I don't have any inflammation. I don't have any pain. I don't have any stiffness. I don't have any joint issues. I don't need to be calm. I'm calm already. I'll continue taking my ashwagandha or the Formula 13 that you give me. Like, there's gonna be a lot of things coming in your brain, a lot of stories you might be telling yourself that can prevent you from purchasing the four. Nothing will happen to you when you purchase four. Bad things, that is. You can only gain from purchasing four. It is an investment you're making in yourself and your health when you purchase four. And you are going to feel something is working when you purchase four. Like, I have one of the patients that was a beta tester. She has no kids. She has no pain. She's not PMSing anymore. She's into her menopause. Okay? But because she trusts me, she's been with me for a long time, and she knows that I would never recommend something that will not make her feel slightly different. She said, Dr. Genty, I trust you. I'll go ahead and do it. And she's like, oh my God, my sleep improved. I was less irritable. She didn't even know she was irritable. She's like, I felt a sense of calmness. It's like people weren't irritating me. When I go to work and then, my boss can be, she said, the word bitch. That's her words, not mine. She said, like, my boss staring at me wasn't a problem anymore. I just look at her and I smile at her and I'm gonna pray for her. That is the thing, because sometimes we don't think we need the thing, because as I'm educating you guys on the benefits, you check in the box. No, I don't have this, I don't have that, I have that. No, not with CBD. People take CBD for pain. Cancer patients need CBD. Osteoarthritis patients need CBD. Stiffness in the morning, you need CBD. If you're waking up at 3 a.m. in the morning and you think it's your hormones, yeah, cool, could be your hormones, but as you are working on your hormones, right, your progesterone is not absorbing properly, or your cortisol is, your adrenals are puking a high cortisol in the middle of the night, CBD is gonna balance, it's gonna calm your nervous system. And it's also gonna help with your adrenals too. So I'm not bringing these things to you guys because like, oh, it's just another thing. If you guys know me, I am all about results. And I literally want every single person that comes into my space, my environment, my business to live with a sense of increase. Because I know it's hard out there. It's money that you're spending that you could be allocating somewhere else. And as humans, we don't think of ourselves first. We want to spend money on everything else, and then we think of us last. My journey is to make you think of you first. Because when you're good, when you feel good, when you function at a higher level, when your brain is working properly, when you're less anxious, less inflamed, less, with less pain, and you're sleeping better, you're resting better, you present better to your world, to society, to the world, to the humans that you need to be there for. Right? So CBD is for everyone. And if you're watching this video and you stay until the end, I have something to tell you. So we are doing an info session because I can sit here and come here and be like, oh my God, CBD is the greatest. I have 5 people that did it and they did well and blah, blah, blah. But you're like, yeah, but I have questions. Yeah, I'm a little skeptical. Yeah, I don't think about this. Like, I'm really going to hold on to my money. I don't want to leave my money. I don't want to give you my money. So we're doing an info session and I want all of you to show up. Bring your questions. It's going to be myself and Ty. We've been studying. Okay. Ty used to work at a dispensary, so he knows about CBD. Me, I've been working with the practitioner that created the CBD, and we have multiple calls. We have trainings by these people, and I have questions. I ask questions, and they have webinars. I show up for the webinars. He sent me a whole bunch of research studies because I, like your stuff, I'm like, is this gonna work? Because I know I'm recommending it. You believe in me, you believe in what I'm telling you. So if something goes wrong, it's on me. Dr. Genty, you said. So I have to do my due diligence too. I have to study this stuff too before I put it out in the world. I have to make sure I'm doing it. I'm like, okay, I know all of the things about it. And I just say, hey, do CBD and you're gonna be amazing. No, 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 no. I'm a doctor by heart. I want the science. I want the research studies. I don't want my people to be the first guinea pig. You guys are never my guinea pigs. Never, never. Try it on me, try it on Marilyn, try it on Ty, try on all of the things. Marilyn's family. And then I'm like, okay, good. I have enough data. I have enough knowledge. I have enough evidence. Now the people are going to get it. So if you show up for the info session that we are hosting June 24th, when is it? Oh my God. I should know this. I'm looking at okay, June 24th. Okay. It's June 24th at 5 p.m. You're going to see the link to register. Bring your questions. If you know anyone that has pain, please, I am pleading with you to bring them to the webinar. People are suffering out there. People are having multiple back surgeries, knee pain every day, where they have to end up using a walker on a wheelchair. If you care about humanity, you care about your fellow humans, your brothers and sisters, like, and you have a caring bone in your heart, you're going to bring these people to the webinar. It's June 24th at 5 p.m. Eastern Standard Time. And for session, we're going to have a few slides on CBD. And then we're going to open it up to answer questions. If you show up for the webinar, we're giving you an extra discount. Okay? This is an incentive for you to say yes to yourself and purchase it. And it's only going to be available during the webinar. only, only during the webinar, we're gonna give you an extra discount. So you're gonna pay for that 4 CBD drip that we're packaging at a very low cost. Very low cost. Very low cost. So if you wanna save money, okay, and you want to literally pay a very low cost for this drip, you need to show up for the webinar. And it's a way of me saying thank you for spending time with me, for taking, again, time out of your busy schedule to show up, to educate yourself, to see how this new addition to our family can help you. Thank you for showing up for yourself, for believing in us, for trusting us. You get the extra discount. And again, it's going to be very low cost. I mean, I look at the price and I can't release it yet because I'm like, is this legal? I can't. So we're going to release the price during the webinar. You show up during the webinar, you get the price. And then when we will send out the replay, the price is gonna go up slightly, and the price will continue going up. That's how we're gonna do it. Because I really want people who I really want people who desire to feel better. I don't want tire kickers. I don't want people that are like, oh, I don't know. I mean, like this, I've been doing this work for 9 years now, or 11 years with my dad having cancer. So I would never recommend put something into your vein that will damage your body. Never. It's my license, it's your family, it's you. Like I am in the business of caring and healing, not hurting. That's why I left the conventional medicine because I was not healing and I wasn't caring about the people. So you show up for the webinar. I promise you'll be worth it. But we want serious people who's on a quest and a journey to heal and feel better. That's it. If you're one of those people like, oh, next time, then this is not the webinar for you. Don't show up because at the end of the day, you can stay where you are and think everything is well, or you can actually move on. Like say, okay, is there something better out there for me? It's 4. You start with 4. Package of 4. You cannot purchase one. And it's not gonna happen. It's 4. Clinical judgment 4. I'm the expert 4. And there's a discount on the 4. And the discount and the price is gonna be the lowest ever. I promise you, it's the lowest ever. And I'm negotiating with the company to see if us, like the company can get a big discount so we can really decrease it to the price that I want to give it out to you guys. Okay? So please, if you have mothers, brothers, sisters, anybody, friends, co-workers that come in and they are limping and they are talking about, oh, this back pain, oh, my neck is so stiff. CBD is good for all stiffness, guys. Oh, this osteoarthritis is really hurting me. Oh my, like whatever pain, even gut pain, stomach pain too. CBD can help because what does it do? It decreases inflammation. Because of you decreasing inflammation, you decreasing the pain. It's giving your cells time to work and to recuperate, to decrease the stress on your cells, to give them time to breathe. Relaxes your nervous system. And I'm telling you, as I'm studying this also decreases your cortisol. And I'm waiting for the research study. I'm like, this is crazy. Because it's gonna help with the neurotransmitters, right? And the cortisol hormones. CBD is really good. I have yet, and I'm trying to really find a group of people that will not do well with CBDs, maybe pregnant people and kids, but adults. If you have an aging parent and they talk about pains all of the time, please purchase them some CBD as a gift. Okay? If you find yourself not performing because of aches and pains at the gym, or you don't have the capacity to like do the things that you used to, CBD. CBD is really good for inflammation, for pain, for discomfort, for stiffness, for irritability, for headaches. One of those of the people that are suffering with headaches, then they have to pop a semaglutide, CBD. Okay? And as you all know, we start slow and then we increase. So if you're thinking about safety, I already have that taken care of. We're gonna start very slow. And then what I'm going to do, I'm going to put all the people that purchase CBD in a group, in a HIPAA compliant group, so I can check on all of you guys. Send you a message. Be like, oh, how we doing? So that I can help you this way. Okay? Because I want you guys to give me feedback. Because this CBD drip is going to be a staple in mine. Because I would love to help people prevent from having multiple back surgeries and taking the medication for pain. That's only, we're putting them at risk for side effects. All right, so that's it. So the webinar, the info session is June 24th, 5 p.m. Eastern Standard Time, June 24th, 2025, 5 p.m. Eastern Standard Time. If you show up for the webinar, you get an extra bonus, fast acting bonus, with decreasing the price even more on the webinar. Just to say thank you. And I want you to show up with a friend. Don't come by yourself. Okay? If you know someone that's having a birthday, purchase some for them. All right? Thank you so very much. So you see the link below somewhere here to register for the webinar. The registration stops on the 22nd, I believe. You cannot register anymore. Bring all your questions. And when you do register, please put in your calendar. Okay, and then after that, the price will go up. Because it's not fair for the people that actually take time and to show up and then for them to get the same price. Okay, so it might be still a lower price, but it's not the price it's going to be during the webinar. So if you want to save an extra few couple of dollars, show up during the webinar because the price will go up. All right, so thank you so very much. I'm going to be doing more about CBD and pain. I'm going to educate you guys even more about it because just like you, I'm sure you want more information before you say yay or nay. You have 2 weeks. The webinar's in 2 weeks to say yes to yourself. So I'm not asking you to make a commitment now. Although if you feel like, okay, I want to purchase the CBD, we'll give it to you for the price that we're going to give it to the webinar, the people in the webinar. That's fine. Because you trust me and everything that we've done so far, I've got your results, and then you have some residual discomfort and pain and inflammation. That's fine too. If you have autoimmune condition, you want to start working on, decreasing those autoimmune markers, like regulating your nervous system, you can give us a call and be like, hey, I saw this video. I'm interested in purchasing the four. What is the price? Because, I just want to get going. That's fine too. That's me. I'm these people. I'm like, okay, why do I have to wait 2 weeks? Like, I know it's gonna help me. I don't want to wait 2 weeks. I'm ready now. So that's you. Reach out, and Marilyn will give you all the information. Until then, register for the webinar, please. Keep us open our emails because we want to educate you so you can be a sound consumer when it comes to CBD. That's gonna help you make the best decision ever. So until then, I'll see you in the next video. Bye.